Hello everyone. Thank you very much for joining the workshop. For those of you that don't know me, I am Ruth Mulholland and I work in the safeguarding team in Volunteer Now. And really for the next 45 minutes, what we're going to be looking at are some key issues in terms of safeguarding and the pandemic and how your organisation can work to support children and adults that have been affected by those. So I will just start to share my screen here. Okay, so hopefully you can see those all right. The workshop is Keeping Safe, Impact from the Pandemic. And what we look at are safeguarding issues during the pandemic, some statistics and trends, and the organisational response really that we should be all thinking about. Just in terms of the workshop, what we'll do is I'll present for the next sort of 20 minutes or so, and then we'll have 10-15 minutes for a question and answer session, and my two colleagues will be joining me for that part of the workshop. Just to mention that this may trigger some feelings for some of you, so if you do feel that you have to leave at any point or take a few minutes away, that is fine. And just to remember for the question and answer session that you don't make any disclosures about abuse, and just think about the information you share and remember not to disclose any confidential information. So just a wee bit of a warning around those two things. Okay, so the key issues that we're going to focus on today, there are many, but we don't have time to look at all of them, are domestic violence and abuse, mental ill health, and substance and alcohol abuse. And we're going to think about how they have impacted both adults and children, and as I say, what our organisations can do to support those individuals, what we need to think about in terms of our policies and procedures. So we'll take domestic violence and abuse firstly. So you'll see up on the right hand corner there, a clear definition. So domestic violence and abuse is regarded as threatening, controlling, coercive behaviour, violence or abuse. And just remember that that can be psychological, virtual, physical, verbal, sexual, financial, or emotional, and can be inflicted on anyone. And that's by a current or former intimate partner or family member. Lots of people have experienced domestic violence and abuse, and we know that for a lot of the time it remains hidden. So the statistics that we have in terms of the number of people that have experienced it aren't really reflective of what is happening out there in the community. It's often hidden. And I suppose we can't really say that the pandemic caused more domestic violence and abuse, because obviously the cause of abuse lies with the perpetrators. They are the individuals that cause this. But it certainly escalated the abuse, and there were less safety routes for people. So, for example, we know when we're in lockdown that a lot of support nets weren't available. There was staff shortages, which had an impact on support services. Schools were closed, nurseries were closed, which is often the safe place for victims of domestic violence. And unfortunately, home was just not a safe place for many children and adults, especially during the lockdown. So, in terms of the impact on adults and children, obviously victims were spending more time with their abuser. As I say, there was less safety routes available. Research shows that the abuse did get worse during the pandemic. People felt more afraid. They felt they had no one to turn to. One quote from a piece of research that Women's Aid, obviously they work with female victims of domestic violence and abuse, but one quote from one of their service users was that they felt lonely, isolated, and really like a sitting duck. They felt they had nobody to turn to. Perpetrators often use COVID as a tool for abuse, so they use the government restrictions to further control and isolate their partners. And preventing them, for example, from seeking medical attention, all of these things. They used the government restrictions to control even more. And it was harder to leave, because even though the government put out the very clear message that if you're experiencing this, it is okay to leave the home and keep yourself safe, it wasn't easy to do that. And we know that generally overall there was a decrease in referrals in terms of the safeguarding of children and young people, and that includes in relation to situations where there's domestic violence and abuse. In terms of children and the impact on them, they obviously witnessed more abuse to their parents, and research shows that abusers had shown an increase in abusive behaviour directed towards their children. So domestic violence and abuse obviously causes harm to children and young people and adults: physical, emotional neglect. For adults, that can be sexual, psychological. We've talked about all of that. It creates an inconsistent and unpredictable environment. It can cause aggression in children and young people, or they may become withdrawn. It leads to a lower sense of self-worth and often causes anxiety and depression. And we know, like all of the things that we look at in this workshop, that domestic violence and abuse is regarded as an adverse childhood experience and will impact the child or young person sometimes not until later in adulthood. And I suppose what we need to do with each of these individuals is take that trauma-informed approach. So it's important that we know how to do that. And we'll talk about that later on. So taking mental ill health now, you'll see the definition up on the right-hand corner. So refers to a wide range of mental health conditions, and really it's any disorder that affects your mood, your thinking, and your behaviour. So it could be things like depression, it could be anxiety disorders, it could be trauma-related disorders, there could be eating or substance abuse disorders, a whole range. And ultimately, our mental health determines how we think, act, and feel. Some early warning signs in terms of poor mental health would be mood swings, feeling low constantly, lack of care for personal appearance or responsibilities, losing interest in activities that we would have once got involved in, withdrawn from social activities, spending less time with family, disturbed sleep, feeling irritable, oversensitive or aggressive, any of those sorts of warning signs for ourselves. This affects everybody, obviously, or those families that we're working with. They would be signs that we would need to try and get some help for them. And normally the good route to go there is through the GP in terms of initial assessment and getting the support available. And obviously, mental health has been a huge issue in terms of the pandemic. So in terms of children and young people, sometimes mental ill health can cause poor attachment between the parent and the child. It often prevents a carer or parent providing consistent care. Sometimes they become withdrawn or disengaged, or there's often a lack of warmth. It can lead to children experiencing behavioural problems. Again, it can create that aggression or that withdrawal. And it can increase the risk of harm if the parent is experiencing domestic violence and or substance misuse, because I'm sure most of you will be aware that if you take these three issues together, so domestic violence and abuse, mental ill health and substance misuse, they substantially increase the risks for children and young people in that home. And they've become known actually as the toxic trio, and they come up in serious case reviews quite often in terms of the risk to the child or young person. Substance misuse. So again, up in the corner there, you'll see the definition. Occurs when an individual uses alcohol, prescription medicine, and other legal or illegal substances too much or in the wrong way. Again, a huge issue during lockdown. And we'll look at some statistics in just a second. But again, similar sorts of themes in terms of the warning signs and the possible indicators. So not being able to provide consistent care all the time can inhibit the parent from meeting the child's basic needs, makes the parent or carer unable to assess risk to their child as well. And you can understand how that might be the case if somebody is taking a lot of substances or alcohol that they don't know when their child might be in danger. Children and young people often assume early responsibility for their own and others' well-being. So it could be that they're actually looking after the parent who's going through these issues, or it could be that they're looking after their siblings and themselves. And that obviously affects their development and their achievements. And it can cause serious harm, obviously physical, emotional, and neglect. And just coming back to the point of the adverse child experiences, we don't know sometimes when these things are going on, and it might be that we notice these indicators, or the child discloses something to us, or we see the behaviour of the parent and it's causing us concern. It's about reporting that information as soon as possible so that agencies can intervene early and try and mitigate those risks and help children and young people overcome these experiences that they've had, because whilst they'll have been traumatic for the child in many ways, ACEs, adverse childhood experiences, they don't define you, and you can build resilience and you can overcome the trauma that you've experienced. And it's really important to have that mindset when we're working with families. Some statistics, and my colleague Helen, who is joining us later on, has very much been working away on this in the background, so thank you, Helen. So 32% of over 70s in Northern Ireland felt more vulnerable to abuse because of the pandemic. 56% of callers to the Hourglass helpline about domestic abuse were over 75 years of age. We all have our perceptions about domestic violence and abuse, who's the perpetrators are, who experiences it, but I think these statistics are really interesting in terms of challenging our perceptions around it. It can be anyone. The abuser can be anyone, the victim can be anyone. Normally, obviously, with any sort of abuse, it's more likely somebody that knows the person, but we need to just challenge our perceptions sometimes around all of it. Almost 2,000 domestic abuse calls were made to the PSNI in the first 3 weeks of lockdown, and there were almost 1,000 more domestic abuse crimes recorded in Northern Ireland in 2021 than pre-pandemic. And as I've already said, these are just the individuals that we know about. There are many more out there that we don't know about. And, it's always useful to think about the research undertaken in terms of safeguarding children. We reckon that for every referral that comes through to social services, there are about 8 or 9 more children out there that aren't known to social services. So it's important just to remember that, and remember to keep safeguarding very high on our agenda, and to make sure that staff remain vigilant when they're working with children and young people. Mental ill health. So we found some research that Parenting NI had undertaken with parents during the lockdown period. So you can see for yourself there, 88% of parents reported the pandemic had both affected their own and their children's well-being. None of us were really prepared for this. We hadn't known anything like this before. There's so much uncertainty around it all. There still is. And, it has really had a massive impact on individuals' mental health. The 3 areas that caused most concern for these respondents in terms of the Parenting NI research were their children's education, mental health, and fear and anxiety around the virus. And again, the same theme coming through. Some people didn't know where to turn to or how they could get support or help. 53% of parents told Parenting NI that they were not aware of help or support available to them. Substance misuse. Alcohol consumption has increased in Northern Ireland, with 47% saying that their alcohol intake was up through lockdown. The number of alcohol-related deaths in Northern Ireland is higher for males. And UK statistic from the British Liver Trust noted a 500% increase in calls to its helpline since lockdown began. And more than 1 in 10 drug purchases were made on the dark net. And of these purchases, 13% had not previously used the darknet before. And over a quarter of the sample stated that they had planned to use the darknet to buy drugs if necessary. So that signalled a shift during the pandemic in terms of use of the darknet, which is highly concerning. So I think the statistics are quite shocking. We know there has been an increase in issues in terms of domestic violence and abuse, mental ill health and substance misuse, but when you actually look at those figures in front of you, it's quite frightening, and we are still in the pandemic. So when you think about all of those issues, plus these issues in terms of additional risk factors, it has been a very difficult time for some people. Emotional distress, financial worries, if people have been made redundant, they're worried about how they're going to make ends meet, how they're going to pay their bills. Some have been pushed into poverty. Again, there are other risk factors that exacerbate all of the pressures already in the household. Job insecurity, knowing if you're actually going to have your job in the next month or two, the anxiety about that, knowing if you're actually going to have that income, few leisure outlets, confined freedom, homeschooling. When I think back to the homeschooling and managing your work around that and worrying about COVID, all of that has increased pressure too. Worrying, have you done enough for your child? Are you pushing them too hard? It has been so difficult for them too. All of those issues haven't helped. Anxiety or fear, limited support from family or friends, and of course those who have gone through bereavement. And that's not an exhaustive list. They're just some examples, but when you take all of those with those three issues that we've already talked about, you can see how they're all closely linked and how risks can increase in that household as a result in terms of safeguarding when they're all feeding into one another. In terms of your organisation, it's about shining a light on safeguarding. Safeguarding should always be top of the agenda, but I think particularly during the pandemic, organisations have really had to think carefully about how they do things in a different way. The most important thing was to stay connected, and still is, because we are still in the pandemic, but I think the effects of the pandemic might not be felt for quite a while for all of us. So it's remembering to stay connected as best you can with the people accessing your services and activities, children, young people and adults who may be deemed at risk or vulnerable in particular. It's about adapting your services and your activities. Many of you will have had to do that already. Many of you may have had to move online to run services and activities. And it's really important that if you haven't been able to do that to date, that you take stock of how you do that safely, because there are additional risks to moving online. You need those clear boundaries between the children and young people and the facilitator. You need to monitor very careful and think about your supervision. If you're splitting young people, for example, up into breakout rooms or small workshops, think about your ratios. It's gaining permission, all of that, from those who have parental responsibility. Thinking about their platform, for example, who has access to share screen, who can put into the chat. Does the chat come to you? Does it go to everybody? And everyone on that platform knowing that, if this is a live delivery, for example, everybody can see and hear what you're saying. Children and young people in particular need to be told those things. And, thinking how you do it safely. And then that all feeds into your safeguarding policy and procedures. So revisiting it. Is there anything else we need to put into our code of behaviour here, for example, in terms of online communication? Is there any other support that we need to give staff and volunteers in terms of running things this way? And update your policy and procedures. And we would recommend a small working group do that. Come together, a small cross-section of your organisation, to look at where we are, what we've maybe had to change, and then building that in for future delivery. It's to continuing to promote there's a wee typo there, available services and activities, reminding people that you're still here, and this is what you can offer, and encouraging people to tap into those services and keep connected. Continuing to provide information, support and training to those who are working or volunteering with vulnerable groups. Communicating regularly with your team. So if there are any concerns, those can be dealt with quickly, and we can intervene early and get that information through to the appropriate agencies if needs be. Providing up-to-date information for your team, getting them to do training, which has now moved online for a lot of the cases. And that support is really important. And that's one key thing that we know has come out of the pandemic. It's about well-being. So it's about well-being of your service users, but also your team that are delivering those services to children and young people and adults. Encouraging your staff and volunteers to remain vigilant, as I've already said, for possible indicators of abuse. Checking in regularly through staying connected. How are things? Open-ended questions to get conversations going. Give children, young people and adults the opportunity to talk. That's what comes out in many serious case reviews, is that the victim hasn't been given the opportunity to talk about it. An open-ended question. You just don't know what a child, a young person or an adult might say to you. Prepare staff and volunteers for dealing with disclosures. As I said, we know that referrals dropped substantially the first few weeks of lockdown, and in general, they have been lower than pre-pandemic. But as things start to open again, and did at different periods over the last year and a half, it's preparing staff and volunteers for dealing with that. Do they need a bit of an update on how they should respond? Think about their facial expression, their body language, what they can do, what they shouldn't do. Give them prompts in terms of preparing them, because you may find when children and young people and adults are coming back and accessing these services, a disclosure might take place. Connect with and learn from other organisations. We run a series of sessions called Volt, which I'm sure many of you have been to, and we try to have a different topic or theme. We look for themes and topics from organisations that they want to develop or look at further. We can run those. If there's anything at all that you think today is a great opportunity in terms of networking as well, link in with organisations. Don't try to respond to things on your own. See if there's other good practice out there in terms of how things are being done, and continue to deliver those key safeguarding messages. It's about promotion, prevention and protection, promoting the fact that everybody has the right to be safe. Everybody, that basic right, and making sure that everyone within your organisation understands that. Prevention, how do we prevent harm happening in our organisation? Good recruitment and selection procedures, effective management of supporting staff and volunteers, thorough reporting procedures, codes of behaviour, guidelines around sharing information, that preventative work, and protection, making sure that your staff and volunteers know what to do if they have a concern about a child, young person or adult, or there has been a disclosure or there's been an allegation made against another member of the team. What do I need to do here? Who do I need to talk to? How do I record it? Where are our performers? Where's our policy? And that should be everybody within an organisation, not just those working regularly and directly with children and adults, but for example, somebody answering the phone. If they got a disclosure in the phone, a receptionist, for example, does your receptionist know what to do and who to turn to? We deliver a range of safeguarding programs aimed at different levels in terms of responsibility and contact with vulnerable groups. So please talk to us if you think that you need some updates within your organisation. We can also provide you with some support around policy development. We've got our query service. Anything at all that we can help with in relation to safeguarding, please contact us. And also we have a range of publications online that will help you develop your policy and will hopefully answer some of your queries. Okay, so I think I'll stop sharing here now, and we'll have some time for questions and answers. So my colleague Roisin Timlin, who works within the team, and Helen Beggs will be joining me on stage, hopefully in a minute or two, and we can take some questions. Thank you. Okay, we have a question there. Hi Ruth, would you have any specific tips for volunteer telephone befriending with service users? We have made our process as robust as we can, but keen to hear if you have any suggestions too. Thanks. Yes, we actually have been doing this ourselves. So we have some guidelines that we can provide you with in terms of that. Telephone's slightly different because it's not visual. So obviously when you have the visual sessions, the live online sessions, there would be more risks associated with that. But in terms of volunteer telephone befriending, it's going back to the basics, you know, preparing staff and volunteers, because you may find that on the phone, as I said, somebody might disclose in terms of what's been going on. So it's knowing that, letting people know how to respond, making sure your staff or volunteers are confident in responding to that and knowing who to talk to, and having, you know, information about other support organisations in terms of who the individual could link in with. But yes, certainly we can provide you with some more information on that. Roisin, Helen, would you have anything to add to that?
Just backing you up, Ruth, it's really important that staff and volunteers, before they even start their role in telephone befriending, are up to speed on what to do if there's a disclosure made, and as you rightly said, linking to signposting, but also making sure that internally you're recording that and passing it on. And I think I'm a real advocate about code of behaviour, always having your staff and volunteers up to speed on your organisation's code of behaviour, and that they're aware of their behaviours in any aspect, whether it's online or telephone calls, and just things like that.
Yeah, and I think I would second that as well. I think if you do have a concern, even if it's a very small concern after maybe a telephone conversation with someone, it's knowing who to go to. And I think we're all a little bit afraid when we do have a concern. We're afraid of getting things wrong. But, you know, if we pass on that concern and share it with the appropriate person, you know, the right route will come about, and that concern will get accelerated in the right way.
Yeah, thank you. Can you support an organisation writing their own bespoke safeguarding training session? We can. I mean, we have helped organisations. We're actually working with one at the minute, Helen is, in terms of developing a safeguarding session around their policy and procedures. Now, what I would say is that's obviously not a volunteer now course, so that would be your own branding and it would be very much based on your policy. But just some things to think about there. For example, if you're regulated, you know, your regulator might ask that an external body delivers your safeguarding session. There might be expectations there in terms of regulators. Because whenever we deliver sessions, obviously the trainers would be quality assured. So our trainers are quality assured every 3 years. They have a manual to work off. Now we can help you develop a manual, but you need to think about who's going to deliver it within your organisation, and what skills and experience those people need in terms of delivering a good, effective training session. And then, of course, things like evaluating the training session, somebody would need to take on that role as well, just monitoring that things are going okay. And the other thing to think about is keeping it updated. So remembering that it shouldn't just stay the same, that it should be looked at least once every year and updated in terms of any new information, new legislation. There's a few pieces of legislation coming our way very soon. For example, with adult safeguarding, well, not say very soon. I wasn't referring to the stalking bill and the online harms bill for Northern Ireland. There's been a bit of work happening in the background. I've actually just emailed the Department of Health yesterday for an update on that. And we also will have an adult protection bill for Northern Ireland, but it could be a couple of years before we have that. But you'll have all seen this in the media anyway. So But those are key things in terms of training staff to think about boundaries. So those key things, quality assurance, evaluation, and keeping material relevant and up to date, I would say would be the key things. And just the management of those trainers in your own organisation. So I hope that helps.
Okay.
Okay, so just reading through some comments here. Great presentation, thank you. Thanks, Rob. Statistics provided really evidence negative impacts on vulnerable groups experiencing domestic abuse in 70 plus. Yeah, again, I think that really challenges perceptions, Joanne, because we don't always think of older people experiencing domestic abuse, but in a lot of the cases it is. And obviously Hourglass, they are the agency in Northern Ireland in terms of supporting older people that have been affected by abuse, and they have a helpline there. So it'd be interesting it would be useful, for you to include that in terms of referral points. So we have another question here. As we move more and more online, how can we ensure that this does not compromise the strong safeguarding practices and behaviours? Yeah, I think that definitely is a very valid question. There are challenges around it. But I suppose, moving online has allowed us to get the message out wider in many ways. Our scope in terms of people attending online training, for example, has been fantastic. It's not our preferred method being online, and Helen and Roisin will agree with that, but we've had to do it. And remember, just thinking about safeguarding right through from someone coming into even before they come into your organisation, right through until they finish. If someone applies for a role in your organisation, it's putting your safeguarding policy statement out with the application forms from the very start. Before they come in, they know that you have standards that staff and volunteers must adhere to, and this is what you're expecting, so they know very clearly. And then reiterating that, implementing your robust recruitment selection, having your clear recruitment procedures, talking about these issues regularly with staff and volunteers, and that's usually through team meetings, support and supervision, keeping it high on the agenda. And all of those things we can do online. But also the wider message in terms of your organisation and your social media outlets and all of that, getting those messages out through there as well to let people know that safeguarding is high on your agenda and you take it very seriously. And that consistency in your organisation as well. When there has been an incident or an allegation, it doesn't matter who's involved. There's an approach here that will be taken, and reiterating that there's a consistent approach and there's a zero tolerance of approach is really important. Roisin and Helen, you want to jump in there?
Yeah, I back you up, Ruth, what you're saying, and I agree. I mean, a safeguarding policy and practice needs to be a working document, not something that's, filed away in a cupboard somewhere and only brought out when there's an issue. Everyone within the organisation needs to be aware of your policies, practices, your code of behaviours. And as Ruth said, it needs to be there right from the beginning. As that really does help unintentional things being missed or not reported. And in relation to online, I was really, I suppose, didn't know how I was going to go initially. We're all, including Ruth, all deliver safeguarding training. For me and Helen, it's the core part of our work. And I have to say, right now, after doing it now since the start of lockdown, we have been inundated with online requests for training. And as Ruth said, we really wanted to have something as opposed to nothing happening. I know, and Helen probably will agree, we've kind of got used to it now. And I know myself, a lot of the training I deliver is now more accessible to people because they can log in from home. There's not that barrier of, how do I get to that training session, or I don't drive, or that doesn't suit me. For me, myself, we have had to really take our training delivery and change it up. Because our delivery of training it's a learning environment. It's very scenario and exercise heavy, and we've had to really look at that and tailor it. But I personally think for the groups I support, a lot of the arts sector with their safeguarding, we're getting brilliant feedback, and I think going forward, It's going to be something that we're rolling out continually. Obviously, if there anyone that wants face-to-face, and ourselves as trainers would like to still dip into that face-to-face, but I think organisations have embraced the online option at the moment.
Just Helen, can I just answer this last question? I'm conscious of time. Somebody has asked about
The network.
sharing good safeguarding practices. So the question is, Volunteer Now have the Befriender Network. Is there a possibility of a similar group in terms of sharing good safeguarding practices? There are networks already out there. So within the structures of Safeguarding Northern Ireland, we've got the Safeguarding Board for Northern Ireland in terms of safeguarding children and young people, and there are subgroups that sit under that. And in terms of adult protection, we had NIASP, but some of you will be aware that NIASP was stood down, the Northern Ireland Adult Safeguarding Partnership, and we have an interim transformation board at the minute. Hopefully we're going to have our adult protection board with statutory footing, but that's in a couple of years. So underneath that interim adults transformation board, we're also in the middle of developing a series of subgroups, and there'll be lots of voluntary and community representation in those subgroups. But the other thing to mention is I talked about VOLT, our sessions, Volunteer Now's network sessions, voluntary organisations linking together. So there is no issue at all with us running safeguarding votes. We have done some through the pandemic. We can do so if people felt that there'd be an interest in that, we will schedule some for the new year. We'll see what uptake is like, and that's where you bring your safeguarding issues to us and we help you, and we can connect and learn from all of the other organisations at the table too. So there's definitely an opportunity for more of those. So we'll have a look at that our end and keep an eye out then for those going on the schedule. They're just on our training schedule on the website. So I hope that helps. And if there's a particular issue you want to look at, don't be afraid to email any of us. I'm sure you'll be provided with our email addresses after today. Okay, so do we have any more questions? I hope you all found that useful. Very different for us. We're used to seeing everybody on Zoom. So thank you for listening. I hope you got something from it, and I hope you enjoy the rest of the day. Thank you. Oh, we have another question, have we?
No, just very useful. Thank you.
Okay.